So good job with the shout-outs. We're going to do another round of shout-outs for events and such after this. But now we have ChartWorm.
All right.
And patiently waiting there, so you're on.
Okay, thank you. I'm Dr. Rich Hamilton. I'm a physician at Drexel. And I want you to think of the last time maybe you took your mom to the doctor's office or your child, and the doctor's asking your mom a million questions, and you're saying, how come these doctors don't know what they're doing? Why don't they know what medication my mom's on, or what her medical history is about, and why are they relying on my mom, of all people, to give you that information? So that's basically what's called coordinated care, and it's severely lacking in healthcare today. And it's the holy grail of optimizing healthcare. Medicare, which is CMS, has put together a program called Meaningful Use, where you're supposed to develop technologies so that you enable coordinated care and improve safety and communications. There is a huge impetus to do that, and that is the huge waste of healthcare dollars today. $750 billion in just wasted repeated tests of all things. CMS is not exactly paying for it. What they've done is created a system of first incentives and then penalty phases if hospitals and providers don't start doing things to get coordinated care. And so hospitals and providers are starting to use vendors, EHR vendors, to help them work through this coordinated care problem. So who wants coordinated care? Your mom does, okay? And according to surveys, 100% of people who have chronic diseases want it, and less than half say they get it. Who's going to pay for it? We think the payers have a big stake in this. Patients with chronic disease cost them a lot of money because of wasted dollars on their health care, and that's what we're going to call our enterprise opportunity. And we think the electronic health record providers who are putting out portals now have created a solution to meet meaningful use. Here's a portal. Please, patients, sign up for it so we can say we're communicating. But the dilemma is that they're all stovepiped. In fact, most patients, if you look at the Hamilton family, we have roughly 7 or 8 portals that we are now possibly going to have the opportunity to connect to. And of course, we're not connecting to any of them in any real way because it's just too much of a pain in the neck. The connectivity was designed to help the doctors meet meaningful use. So nobody successfully engaged the patient, and that's what we're trying to do with ChartWorm. So the elevator pitch on ChartWorm is that it's basically mint.com with Snapchat for healthcare. We're going to go out there, we aggregate from portals all the healthcare information, and then enable you to share it with your doctor on a time-limited basis in whatever way you feel comfortable. Plus what we call our secret sauce, which is close the loop, and I'll show you what that's all about in a little bit. So here's the app, and this is my account. I'm signed into, let me get this a little bigger, whoops. It says on the ChartWorm should be presenting. All right. All right, here's my account, here's my conditions, and this has been, you can just see a month ago I started getting ringing in my ears from too much rock and roll, and I went to the doctor and he hit me with a million different tests in that short period of time. Here's my medications, my allergies, the vaccines that I have there, and that was built by aggregating 3 different portals. This is the Independent Blue Cross portal, which is my insurance company. This is Allscripts, which is actually, we're calling it Allscripts, which is actually Follow My Health, which is their portal, and Quest Diagnostics, which is the lab portal. You can refresh these portals before you go to your doctor and get all the latest information before the doctor's visit. What's interesting is that you'll find out is that each portal, right, lab portal, pharmacy portal, you name it portal, is so stovepiped that it doesn't necessarily contain information that's helpful. So here's Allscripts. I got 0 records from my doctor's office portal. Most of the records I'm getting are from IBC and Quest. So if Allscripts is trying to actually follow your health, they're not actually doing a good job. And the pick, whoa, what just happened there? I did it somehow. Let's see, what was it, Safari? So anyway, all these are so stovepiped and I'm not talking to each other. Now, what's fun about this is also that I can go and then share my data when I go see the doctor. So I've aggregated my data, or I've aggregated my mom's data by logging into her portals, and then I can go and say, I want to share this data with Dr. Rich Hamilton. And I just want to share it for a day. I want him to look at that data and get all my medical records and all the information. And if I decide I don't want to do that, I'm just going to cancel that, and Dr. Rich Hamilton's not going to see my stuff. If I'm the doctor and I take a look at this, when you show it to me, and I'll say, oh, let's see, if we had a cholesterol test, and look down through the patient's lab test, and I can actually find the cholesterol test that the patient had, and take a look at it, and see that, okay, here's the last cholesterol, it was done a year ago, and the source for it, and this is important for a physician, this gives them some validity. It says, we got this information from Independence Blue Cross on March 25th. If as a patient or what have you, or as a physician maybe helping a patient, I might go through this and say, well, oh, these two tests are basically the same, so let's just clean that up and mark that as a duplicate. And you can see by just aggregating, putting it together, and giving it to the patient can just clean up their health record and have something nice to coordinate their care with. So what about close the loop? Well, close the loop is a phrase we use in medicine for open items, okay? So you are over 50 and you should have a cholesterol done to screen for high cholesterol. Well, ChartWorm, the secret sauce in ChartWorm is going to be that ChartWorm, since it has eyes on all these portals, can basically say, oh wow, we see a bill for cholesterol screening. We can ask the patient, did you get your cholesterol screened on this date? The patient says, yeah. That loop is closed. We know that healthcare objective has been met. And we can do that with colonoscopies, all sorts of things. And actually, we're going one step beyond that, and we're hoping to work with portals to do things like starting the communication process back and forth to say, hey, physician, your patient has not gotten this test done. And then send a reminder, or have the doctor say, remind my patient that this test needs to be done in 6 months. And ChartWorm can then look on the billing side of things and see if that has been done and billed for, or what have you, and shows up on the IBC website. Next steps for us is that we're going to roll it out to our actual patients and physicians at Drexel. We're going to survey them for use and usability. We're looking for patients, we are looking for beta users. So if you are someone, we're specifically looking with people who they themselves or their family members have chronic healthcare problems, who actually have an IBC as their insurance. We've already approached Allscripts about partnering with co-development, and we're approaching IBC with the same ideas. And Allscripts is going to be hosting us to go the next step and develop an API so that we're less reliant on just web scraping to get information from Allscripts and what have you. And that's the juice.
All right, good job. Good job. So, yeah, this is kind of like how we would expect the medical system to work. I'm looking at someone like, yeah.
You mean it doesn't work this way?
I'm like, we have all this data, all these databases. So I guess the question is like, okay, this is really something that needs to roll out to all, health providers nationwide. So I guess the question is, how is that going to happen? Is there anybody else working on it similarly with you? I mean, what's sort of the process from getting it to great demo, great idea, to I can walk to whatever physician and they have this?
Yeah. So we have protected the intellectual property on it. We're the first one to put it together in this way, aggregate, share from any site, and then create this close the loop function by actually studying all the information and doing data analysis on the information. The only other group that's close is what's called Blue Button, which is a government initiative, and it mostly basically takes VA or government information and then hooks it using QR codes and allows the patient to say, hey, if you want my chart, then snap on this QR code. Each portal is trying to sort of use a Blue Button initiative a little bit to do a PDF, but the problem with these portals is, again, they only see their piece of it, right? The payers have probably the best access, but even that is limited. So getting all the information together, we're the first one to do this type of thing.
Yeah, so obviously, I got a bunch of questions. Brian's got some here. Brian?
I don't have any chronic problems, but I really want this.
Okay.
I want to live till I'm 90. How are you driving adoption? Is it to the end user, or are you having the insurers drive adoption? Because there's so many different parties, I'm confused about how you're going to place it in the market.
Right, so we're figuring that out. Right now our plan is what we call a freemium plus enterprise approach. In other words, we think that there are folks that will want to get this right away, and we're going to give them for free the aggregation and sharing piece. They can then purchase the close the loop piece as well. And then we think that we'll sell an enterprise version to payers. And that the payers, they'll see a value in giving this to people with chronic diseases. You prevent one readmission for a heart failure patient and you save $20,000. So if a heart failure patient, can somehow get a little bit more coordinated care because they or a family member is using this app, it pays for itself. And not, forget the population health component of just getting everybody their colonoscopies and whatnot. Now, the other possibility is that we think that portal creators and EHR vendors realize that they've given people a portal, but that the portal is empty and nobody's engaging. And we're getting to the point of meaningful use where you have to show outcomes. And so we're thinking maybe this also might be technology that would spin into a company already building portals and say, well, we want to, build in this ChartWorm feature into our software.
Yeah, because it sounds like one of the big things that you have is like this aggregation where you're going out to all these sites and doing the back-end work, which I'm sure is probably very challenging because you have to mix and match data from multiple sources.
Right.
And you have maybe patient names that aren't matching up and blah, blah, blah. I'm sure it's a fabulous experience making that work.
But there's our team right now.
I'm sure that's actually probably most of your challenge, right? It's just
Gene has already gone bald trying to get it.
There you go. I'm on my way. So I guess three questions for you. I know Greg's got some questions, but first one is really simple one: HIPAA compliance. Because I'm sure that's like the big thing. You have a big database of all these patient information.
Yeah.
That's could probably be that's
Yeah,
like a
so
really
we-
great source to hack. You know what I'm saying?
We broke the code on HIPAA because guess who is the only person that has free reign over their healthcare information is the patient. Okay, so if I'm accessing my portal, downloading that information, and sharing it, then I'm the only person, according to HIPAA, that can do that. Everybody else has to ask permission. So the only issue comes in the sharing component. In other words, if I then fax something to you or share it with you, what's my problem? Well, I don't have a problem, you do, because now you have to just be compliant with my HIPAA information. So we think we have a good solution, and number one, and that's number two, that's probably why patient engagement hasn't happened yet, because all these other healthcare exchanges and connectivity require so much permission and so many HIPAA rules because they've left the patient out of it.
So two other questions in here, so I'm sure I'm eating into this question. The second one is how does this compare to the idea of the electronic health record? Because that's been in the last 2 or 3 State of the Union addresses, right? And then this year, I think what President Obama said specifically, that there was something that was going to be done about this particular issue to drive down the cost of healthcare, right? Because obviously we're doing a lot of unnecessary tests and all sorts of stuff, and people are being treated late. So a lot of it has just to do with what are the unnecessary tests for? Are people being treated late? Just bad information. So how does this correlate with these major initiatives right now?
Yeah, this is, in fact, there's been some posts on some blogs and observations that, one we just saw a month ago, somebody said, how come we don't have a mint.com for healthcare? And we were all, our ChartWorm group was like, we got to tell everybody, this is so necessary. Just a word about EHRs. EHRs were built to help doctors bill. So in their DNA, the bones of electronic health records is not patient engagement. Everything has been a bolt-on to that. And so it needs a different approach, and that's why it's been so slow to actually come around to this realization of what you know, care coordination needs.
We're gonna see you at the next State of the Union address?
I don't think so.
Greg?
So just two markets that we're attempting to sell us to is one, to healthcare insurance companies. Maybe they can put in an add-on, free add-on for their customers. So maybe that would be a market you can say, hey, load this up to your system.
Right.
And the other one is for the pharmaceutical industry. Maybe if you had your database set up correct, nicely, then they can say, hey, I see this person's doing high blood pressure medicine. Here's my name brand high blood pressure medicine that you may want as an alternative. So there's two markets where you may want to generate income so that people aren't paying for it. Because now you got the pharmaceutical saying, hey, if you see this, please put my ad up, and then it's a free service to the general public. So that
Yeah. I mean, that's always, monetizing the patient's eyeballs is always a approach, but we think that the first idea that you had is where the real success will be, that enterprise version where, you know, IBC has a pretty robust portal and an app, but again, it's agnostic to what's going on every other place. And especially in Philadelphia, this is a great market for us. Patients often get their care from 3 different hospitals, 2 different systems. They see 4 doctors who have different practices.
Well, the insurance company may want to pay their IT department to develop this. You just roll on here, it's done.
Yeah.
You know, blanket, you can say,
Yeah. We're trying to find the right guy at IBC to actually say that to.
Sounds like you maybe have some connections, maybe?
No,
Okay. He's got great ideas. Okay, good. All right, other questions or feedback? This is kind of really important. I mean, obviously, so I guess the question is sort of where are you at, right? Where's the company at? You talked a little bit about you here in the Drexel system.
Yes.
But kind of like, what does that roadmap look like, and how are you going to get to where I know you want to be?
Yeah. So when we talk to Allscripts about what I guess we would describe maybe a little bit of spin-in, where we say, how would you guys ought to buy this technology from us and make it part of Follow My Health, or at the very least, you should use this to help populate Follow My Health with good data, because Follow My Health doesn't have good data in it. They wanted a use case. You know, they wanted to see a use case, and so that's what we're doing next. We're going to get 50 to 100 patients in the Drexel system, give them ChartWorm, give their doctors ChartWorm, and start seeing the adaptability and you know, see how folks like it. Go back to Allscripts and say, because Allscripts knows their data on how many people have and have not signed up for their portal, and it's not going well.
All right, cool. Any final questions? All right, got one here, and then we'll wrap things up pretty soon. Yes, Dennis.
Could you use the data to predict, use some modeling to predict medical problems in the future?
You could use the data to, for example, say you're a smoker over age 50, you have a 20% of having chance of having this condition unless you get a healthcare screen done. Right? So that would be, you could tell the patient that, like, without a colonoscopy at this point in your life, you have an X% chance of getting colon cancer. With a normal colonoscopy that you just got, good for you, you know, your chance of colon cancer just went down. Yeah, you definitely could do something along those lines. Yeah.
So it's about early detection and prevention, and I guess it's